Welcome back. The time's now 9:16. Chronic pain affects over 20% of adults in the U.S., and it's one of the most common reasons adults seek medical care. That's according to the CDC. Dr. Sarah Schwertner from Primary Care Plus joins us during Pain Awareness Month to discuss how best to manage it. Dr. Schwertner, good morning, and thanks for joining us.
Good morning. Thank you for having me on the show.
So first and foremost, let's clarify what chronic pain is. I know it's not just persistent, yes, but really define chronic pain to our viewers.
So there's two types of pain, acute pain and chronic pain. Acute pain is when you have an injury that will heal, the pain goes away, such as cutting your finger, burning your hand on the stove. Chronic pain typically lasts longer than 3 months, and it can also be accompanied with things like fatigue, depression, things like that actually worsen the pain.
And are those pains associated with other more serious injuries or ailments typically?
Typically, we see chronic pain in conditions such as spinal cord injury, back problems, things like that. And it goes on for longer than 3 months, like I said.
And you mentioned depression is sometimes accompanied with that. What is the connection between chronic pain and mental illnesses?
So statistically, they say that depression is about 60% of the people with chronic pain have some sort of depression. And they treat it with antidepressants. There's physicians that prescribe Cymbalta, things like that, which actually helps heal the pain, treat the pain, and also the mental toll it takes on a person.
The good news is for people out there who might be suffering from chronic pain and may have been suffering for quite some time, they can seek out help from a doctor, from a medical professional. At what point should they be seeking help, and what kind of treatments are available to them?
So really, you should go see your doctor if you're having any sort of pain. And chronic pain, there are treatments such as muscle relaxers. They can order physical therapy, occupational therapy, even cognitive behavioral therapy. Occupational therapy is when you're taught how to do simple tasks without worsening your pain. Physical therapy teaches you stretching and exercises to do that can reduce your pain. And also cognitive behavioral therapy actually helps teach how to cope with your pain mentally.
And you mentioned all these different therapies. I know often people assume, I have this persistent pain, be it in my back, in a knee, what have you. I know that if I go to the doctor, they're going to give me pain medication that could lead to addiction. There are people out there who may think that and may be at home suffering, but you just mentioned a list of other options out there that could be, given on their own or can go along with a medication that can help them. And that's the good news for people, right?
Yes. And also reducing your risk of chronic pain by low weight exercises, increasing your sleep, reducing stress, things like that will help lessen your pain as well. And eating healthy too.
And what else, anything else you want people to know about chronic pain? Again, this is something that most people or a lot of adults are walking around with every single day, and they kind of feel like they're alone in this, and it's something they have to just deal with. But is there anything else you want people out there to know if they just feel overwhelmed, fatigued by the chronic pain that they've been living with?
I think that there's hope, and that you should seek a medical professional, preferably a physician who can treat it. Primary care physicians can treat chronic pain. We don't usually use opioids because of laws in Louisiana, but there are other methods besides just medications that we can order to help live with chronic pain.
All right, Dr. Schwertner, we appreciate your time this morning. Thank you so much.
Thank you. Have a great day.